I've done this job for over 22 years and I actually really enjoy seeing the patients go home. The team's really good, everyone's really supportive if you have any problems. We all try and sort of pitch in and help each other. It's nice to be able to help people.
The opportunities for learning are huge, which I personally really enjoy and value from the role. The team is fantastic. It's a really good bunch of people to work with. If you're considering it, I would say certainly apply, find out more about it. It is a wonderful role. There are lots and lots of opportunities available to you. And yeah, it's good fun. If it's something that interests you, certainly find out a little bit more, and I would certainly say go for it. I'm really glad that I chose to come into this. I really enjoy it.
Came in here with 2 years experience as a carer, no qualifications at all. As soon as I joined here, within a couple of years, I was asked to be a senior carer. It's really good, and for those who want to progress, it's excellent because you can go anywhere. You can do whatever you want. I mean, I came from a carer to, I'm now a deputy manager. I mean, I would never have thought that.
It's like a family. Everyone supports everybody. Doesn't matter what role you're in, everybody's hands-on. I mean, I like to walk out of work and have a smile on my face because I've made a difference.
I would say you've got to have the values there. You've got to have care, compassion, a big heart.
It's a rewarding job and it's an amazing job. You get a lot of fulfilment at the end of it.
I started as a healthcare assistant in a nursing home, but I wanted to find out how the hospital setting was like, so I applied for a job here with the trust. It's an emotionally rewarding career, to be honest, because more often than not, you feel like they've made a difference.
I spent 23 years in the British Army, and on retirement from there, I wanted a different challenge. I started off as a healthcare assistant because I believe that's where a majority of the interaction takes place, and it's a great place to learn.
I've been working for the Trust for 38 years and I haven't looked back once. I enjoy every moment. We all support each other. We've got a wonderful manager and ward sisters, and all my HCH and staff nurse, they're all brilliant and we all work together.
The training they gave you is absolutely outstanding. We're not a team, we're a family.
I started in support work about 12 years ago. Started as a support worker and have worked myself up to a lead support worker role and now a deputy manager role. Working with adults with learning disabilities. Never really thought about doing support work, but once I was in it, it just came naturally. I've enjoyed every single second of it. It's a very rewarding job. Every day is different. Just seeing the progression generally of each individual. I've worked for 12 years with the same service users, and there's just a huge difference from when I started to now. 12 years ago, I never thought about doing it, but since I haven't looked back.
A friend recommended this position to me. I'd never really considered like mental health nursing or like a mental health hospital. I didn't know what capacity I could work in. And from the back of that, I applied and fortunately got the position, and now I work with great patients, great people every day.
I try to change something in my career, so this is why I try to do do next step like HCA, and I got it.
Before this, I worked in care, so from that I wanted to learn about more mental health, so I came from that and came into the PICU.
I never ever saw myself as doing this job, I must admit, years ago. Yeah, it's great. I can't see myself doing anything else.
They try to train me every day something different, which is very helpful, and I'm happy.
It's a really beautiful thing to be a HCA. You get to have that first point of contact with your patients. You do get clinical responsibilities, but ultimately your role is to be there on the ground floor, mucking in into helping patients.
Sometimes it's like big family. Everybody know each other. It's not a big hospital. And the patient, they are so lovely.
The most rewarding thing about the job, and it always will be, is see the patients go home.
as soon as I did my first day. I loved it. I don't think I could do anything else now. It doesn't feel like work. There are days where, you know, things are stressful or whatever, but I would never get home and think, I don't want to do that tomorrow. The best thing about the job is the clients. They're all completely different. I don't know what I thought they were going to be like, but it's completely different, but it is great. I love them.
My role is exceedingly rewarding. It's rewarding in so many different ways, but mainly it's seeing the progression in the service users and seeing how they develop. I would definitely recommend a career in care. The reason? Very simple. It's so rewarding. It's probably the most rewarding position that I've held within my entire working career.
If somebody was considering a career in care, what I would advise them to do is to come and talk to myself, people like myself, colleagues, people that are already in care, because people that are in care for a reason. So who better to talk to you about a career in care than the people that are actually doing it?